therapist
Perfect.
in town. Just because of these falls, as well as some of the other issues with wandering, the hallucinations that are kind of scary, I think that you're wanting to get some more supervision in there.
Yeah.
Definitely is something we need to work towards.
Yeah.
Now,
I was gonna say, because that's one of our biggest worries. Because again, before Mom died, we weren't quite so aware, and we're really worried whether you can still live down there. I mean, that's my big
it's
worry.
my
I know you
home.
love it.
yeah, it is
You
your
know.
home.
So we're this is a big part of why we wanted to get more information, because we're trying to just figure out how much help we need, or how do we figure that out. 'Cause
Yeah.
I'm very worried about that.
So I'm going to give you a phone number, and this is the area agency
Okay.
on aging, and they have got a lot of resources,
Okay.
and they can be of great
That's great.
assistance.
I know this clinic's been great, but I know trying to get some of this extra stuff down here has been a little tricky.
I know.
So
I know.
that's one of our big challenges. But
Right. But I will get you that phone
Okay.
number, and probably certainly when we see patients that are having some changes in their memory, the finances is a big concern, and then the medications. It's probably the other really big concern. It sounds like that's been an issue. So that's something where we really do need to get somebody into the home that is checking to make sure that he is taking his medications. So it may take a little bit of time for us to get somebody in there, but now you certainly have the cameras,
yeah.
and
yeah.
and then one of the things that might be helpful until we can get somebody in there to do this is if you can just call him when it's time for him to take the medication.
Oh, okay.
Now,
Okay.
there's another strategy,
Okay.
and that is the Alzheimer's Association has a ton of resources there.
Great.
I
And-
have Alzheimer's.
No, we don't know that. This is just one of those really wonderful resources.
Yeah.
And they've got this website, it's like a store. That's a great question, though.
Yeah. I'm just worried about that.
Yeah, I know, but we don't know that until we complete our workup. But I'm just looking at resources,
Yeah.
and they have. You're gonna love this. It's called Rosie the Reminder. So Rosie the Reminder is this clock, and in big numbers, and it has the date on it. But Rosie, you can record messages from you. Hi, Dad. I love you. It's time to take your medications. And so, but then you can watch to make sure he does take them, because you've got the cameras, until we can get some more help in there.
Okay.
So anyway, so that's one of those things. Now, the other thing that we talked about is the hearing aids. The reason that we care so much about the hearing is because that increases your risk of dementia, because the brain needs to be stimulated. And if you're not getting that stimulation, then it's a real problem. So once again, I think it's going to be easier once we get some supervision in there for them to
Yeah.
remind him to put his hearing aids in. But I think that it is important, and if you can pursue working with the VA to
Okay.
get those hearing aids replaced, that would be really important.
Okay.
And then it'll just be part of your reminder in the morning. Hi, Dad. Good morning. I love you. It's time to put your hearing aids in. Okay.
Put it back in the box.
Yeah, there you
Put 'em
go.
back.
There you go. Okay, so the other thing that you talked about was the firearms being in the house. Now, what we know is that sometimes when your memory changes, and certainly when you've got some of this, stuff going on with the anxiety, and we picked up things about, some, rightly so, some depression, and it's probably situational because, your wife has passed. But certainly this is a safety precaution, and I need you to take this really serious.
Yeah, we're worried about it.
Yeah, we need to get those firearms locked up as soon as possible.
Okay.
Okay?
I have trigger guards.
Yeah.
Yeah.
It's just that sometimes when you're having changes to your memory, is that, you can get that confusion. You can also kind of get really sad and down in the dumps, and we just don't want you to make a mistake with your guns, and so you could release those trigger releases. So basically, I think this is a good time until we figure out what's going on, for the guns to just get into a safe.
Yeah, well, Dad, when the family was down a couple weeks ago, with my daughter came kind of in late at night, and it really startled you. And I'm just kind of worried that like when people are around, you might mistake them for an intruder or something, you know. And so anyway, we'll work on it together. But I think it's kind of a good idea. I know you love them, and we can still go out and go shooting in the mountains when I'm down, but I'm worried about them just being there when especially at night when you've been a little more worried and anxious.
They're kind of my security blanket.
Yeah.
Yeah.
That's
Yeah.
why I put the cameras up too, to kind of help.
It's not a gun.
That's true.
Yeah. Well, and I know some of the things are hard, but we just need to wait until we figure out what's going on and get this evaluation completed. So, some of the other things that we talked about, the fact that he's eating microwave meals is okay, but we certainly do have, the availability of Meals on Wheels. And we can look into that. Now, the problem, I'm just going to tell you this right now, is that they don't make any accommodation for people with diabetes. So they're just pretty much generalized meals.
Yeah.
So
I think down there they just have them at the senior center,
Yeah.
and that's really close by. So, but anyway, I don't know if they deliver all, but that's an
Yeah.
interesting idea.
They don't deliver.
Huh?
I used to go.
okay,
Yeah, my mom's there. They went a lot.
Yeah.
okay,
Anyway.
okay.
Yeah. Well, didn't you say there was a place we can call to check on some of that or something?
Yes.
Okay.
The Area Agency on
Okay.
Aging. Yep,
I'll
and
try to
I'll
remember
get
to
you
do
that
that.
phone number.
Okay.
Yeah, because they may, for a while there, they were actually doing this.
Okay.
But you're right, they may have stopped. So much has changed in the last year. I can't keep up with it. So the other thing that we really have to be careful of too is he is on Lasix. And, we don't want him drinking a lot of water, but on the other side of it, we don't want him to get really dehydrated either.
Yeah, worry about that.
And so that is a real common cause of confusion and memory loss. So we need to make sure that he is getting some, fluids. And once again, I think it's going to be easier when we get some assistance in there.
Yeah,
But
because it's
certainly-
been hot, and
Yeah.
you go out in the yard
Yeah.
quite a bit during the day. Yeah,
Yeah.
I'm still mowing the lawn.
Yeah. I like mowing the lawn.
Yeah,
I like water.
Okay. Good. Good.
pretty good about it when I'm down there, but I don't know because, yeah, well, that's good to figure out a way to monitor it a little more.
Yeah. Yeah. It's just a real common cause of memory problems. Now, it sounds like you're kind of working on taking over his bills. Is that right?
Yeah. So with Mom's whole situation, we've had to go through all kinds of getting way more involved, And again, what we found is that Mom's kind of historically done that forever, but even with her work, there's been some stuff that's been confusing to me.
Okay.
So we've been trying to sort all that out in the last few months. And so I'm trying to figure out a way to kind of we didn't have very many bills,
No.
but just trying to figure out a way to
Just
sort that out and make some maybe auto pay. I don't know if we can I don't know. We're working on trying to
Yeah.
do that.
Certainly, if you work with a bank,
Yeah.
and then
Because we want him to feel like he's independent and has
Absolutely.
this money. But I think there was one time where you paid the gas bill a couple times in 1 month or something. I don't know.
yeah, I did do that. I remember that now.
So we'll try and, it's not a big deal.
But
but
I
we'll try-
like to write checks.
Yeah, he does. Doesn't like that. I think it keeps you kind of aware of what's happening. I think the auto pay, that's another problem with that. Maybe we'll have to sit down and go through it every month or
yeah,
something.
and I highly recommend meeting with the bank
Okay.
and
Because they know him real well.
Yeah, and they will. There's some different things that they can do with his account so that you've got access and you can do some regular checks. But you can also set some limits so that he doesn't put all of his money in jeopardy
Okay.
too.
Okay.
So yeah.
I've
Now
always been cheap.
you've always been thrifty. Okay, great. I want you to continue to do
Yeah,
that.
it's that worrying about paying the bill. You pay him 3 times.
Well, mistakes happen.
Yeah, well, and we need to limit that because, like I said, I've
Yeah.
seen some problems.
Yeah, no, it makes sense.
Yeah, and then so the The other thing that, I know this is a tough situation, but it's really important. Until we have the results of your evaluation and your workup, I need him to only drive with somebody else, or to have his neighbor that checks on him to really take him places. And this is just, for now, until we figure out what's going on. So what questions do you have for me?
I don't like that.
Yeah, I'm sure you
Yeah.
don't.
So, is there the hard thing too is that
I like
I just
my
wonder how we
truck.
could test it a little bit more, because I mean I've driven with him and I have some worries.
Yeah.
And again, so I don't know if they have ways to do driving test. Do you go to the driver's license place or what?
So we don't actually recommend that you do that.
Okay.
Certainly in Salt Lake City, there's a place that will do the driving
Mm-hmm.
evaluations.
The worry is like when he comes to my house, he's just profoundly confused. I mean, we've lived in the same place for 20 years, but if he had to drive in Salt Lake, it would be a nightmare.
Yeah.
So I'm not sure how. I mean, Bignell has one road.
Right. No,
So anyway, yeah, but
I completely understand.
I can't drive in Salt Lake.
Yeah, I understand that.
we need to figure it out though, because we're
Yeah.
worried.
So what they do these days, just so you know, is they start with a driving simulator.
Mm.
And so they don't take him out onto the road until,
Okay.
he does the driving simulator.
I wonder if is there a way they can tailor it a little bit more to a rural, I mean, can they take him somewhere, test him somewhere a little bit out of
Yeah.
the city? I don't know.
Yeah.
Anyway, but if you have that information, so we can.
Yeah,
okay.
yeah. And
Maybe we can do like, have you come up for a week or so and do some stuff at the VA and get some of this stuff done, just have you stay at the house.
Okay, maybe.
And then we
I
can-
don't want to stop driving.
Yeah, I understand that. So that's going to be, working with, the area agency on aging, as well as your neighbors, and
'Cause
making sure that
Richfield,
he
I wonder if they do that in Richfield. Because
You know-
that would be much better as far as more similar to where you live.
I know exactly who to call. Yeah, I should know the answer to that.
Well, but that's pretty out of the way. But that would be much more suitable.
Okay.
Because then it's still quite rural, even though it's a little bit bigger town. But
Okay. Yeah. Okay.
I think they have a hospital there. I don't
Yeah.
know.
You know what? I will check around.
Okay.
I will definitely check around. Okay, so, like I said, we don't know what's causing your memory changes. But I am going to tell you there's a lot of wonderful resources on memory problems on the Alzheimer's Association's webpage.
Okay.
And they've got a helpline,
Okay.
but also if you just start poking around there, you will find so much
Mhm.
stuff. There's financial training information. There is, it's an amazing site. Now, they also have resources where now they've kind of gone virtual on everything.
Mhm.
And I don't know if there's a neighbor that could help him join a Zoom meeting with, they have support groups. And they
Okay.
also have support groups on virtually for you as well.
Okay. Yeah, I think
So-
we'll have to get you a new computer. I don't think that thing works.
I don't know what Zoom is.
Mom used to use it. I don't know what she did. But We'll
Yeah.
probably just need to get rid of that
Yeah,
and get you a new one.
yeah, yeah.
We'll see. That'd be another thing to learn.
Yeah,
I don't know. We'll figure
yeah.
it out.
And it may not work,
Mhm.
but I do want you to poke around on their
Okay.
website,
No, I'd
okay?
be glad
Because
to.
there's a
Thanks.
lot of good resources there.
That'd be great.
Now, the one thing that I would encourage is the Alzheimer's Association has this Safe Return program,
Mhm.
and I definitely think that, you should get him registered with that. And that's just so, and although we know everybody and everybody knows everybody around here, but
Yeah.
you are talking about taking him to Salt Lake,
Right.
and, if for any reason, he does wander when he's in Salt Lake, at least he would have that identification.
Is it a GPS or how does it work?
Yeah, no, it's a identification bracelet.
Okay.
Yeah.
We're trying to figure out a GPS thing. I mean, yeah, even down there, I'm a little bit worried about. So anyway, I'll look and see. But that sounds like a good idea to have
Yeah.
that on.
Oh, that sounds great. And then there's also there's an elder care locator that I'm going to give you a handout on.
Okay.
So I'll have a,
Why?
it's just in case you wandered off, and Troy was wondering where you were, and they've got this elder care locator system. And so I'm going to just give him a handout on some of these resources. Now, here's the things that we know that you can do to keep your
Okay.
brain healthy. And that is we need to actually get you up moving around a little bit more. So I know he's been at risk for falling, but can you think of some things that you would like to do that would be safe to get yourself moving?
Oh, I like fishing.
Okay, that's pretty
Yeah,
sedentary,
I
but
like-
the walk there might not be bad.
I like working in the yard,
Oh, okay.
Mowing the lawn.
mowing the lawn.
But there's a pool at this high school. You guys had gone there before. Do you ever got? Well, maybe we can look into that again because the pool would be a good one.
Yeah, I like to swim. I was in the Navy, so
Oh, yeah, of course.
Yeah.
Yeah.
So there's a pool. The high school's right a block away, but I don't know what the. I'll have to check what the.
Schedule is.
Yeah.
so how bad is this gonna get?
Your memory? Well, we don't know that at this time because we don't even know really what the cause is. But we are going to run a bunch of tests, and I've certainly got a good history from you today. But there are things that you can do to help your memory. One is the most powerful thing you can do is to exercise. It's better than any pill we could give you. And so we got to get you doing things regularly. So if you're watching TV, every time there's a commercial, I want you to stand up. If there's a way that you can figure out how to set him up with even a CD so that he could sit in the chair and
Okay.
get some moving. Now they have, at the senior center, they do have some programs
Yeah.
that might be very helpful for him,
They have a pretty good one down
where they
there.
move.
You're gonna write that down, right?
Yes, I have
wonder
all
if
of this.
there's- We might be able to get some kind of I don't know, simple equipment at the house or something. I don't know. We'll look into that.
The safest thing to get is probably a stationary bicycle. So people think about a treadmill, but
Yeah.
actually that's just dangerous.
That makes sense.
You can fall.
Yeah.
With a stationary bike, as long as he can, get up and then keep himself steady, and then, maybe you can just do 5 minutes while you're watching a TV show or the
Okay.
news, and then maybe the next week build it up.
Okay. We'll
And
look into that.
this speaks towards getting that calendar,
Yeah.
and
Yeah.
then kind of getting the important things written down, having that calendar very visible,
Okay.
and then putting, just having structure is
Mhm.
really helpful
Yeah.
when there's changes to the memory.
Yeah.
So the other thing is I want him to really continue to be socially active. Your phone calls count.
Yeah.
Going to church is really important, and visiting
Yeah.
with those neighbors and friends, and even that senior center would be really ideal.
I used to go.
Yeah, maybe we can get him back there.
Okay.
Maybe there's a neighbor who'd like to do that. So the other thing is you like to read. And that is a mentally stimulating activity. That is really good for your brain health. So I'm going to keep encouraging him to do that.
Do you think there's audio books versus you don't like that?
Yeah,
Okay.
kind of like to do what you like to do,
All right.
huh?
I'm trying
Well,
to think of other things that we could add.
I like books.
Now, what about music? Do you like music?
I used to.
Okay. You haven't listened to any recently, huh?
Not since Mom went.
Okay.
We'll
But
keep
yeah, I
thinking
like
it.
music.
Okay.
Yeah, that
Yeah.
might be a good thing. That's been shown to be highly effective too.
Okay.
They call it memory and music.
Mm-hmm.
And then the other thing is I know you're already doing this, is you want him to be as functionally active as possible. So let's not have people come into the home and do everything for him.
Mm-hmm.
You know,
I couldn't.
you couldn't do that.
I wouldn't. No.
Okay. Well, what you're doing right now is good for you. So I want you to stay as active as possible. Now, Troy, some things that I've got for you. Like I said, I have got the resources for the elder care, or the elder locator, the area agency on aging.
Okay.
I've got a whole bunch of different resources with the Alzheimer's disease. Once again, we don't know that you have Alzheimer's. It just got a lot of good
Right.
references there. And then, probably the other thing that I wanted to give you is just, this is specifically for caregivers.
Okay.
And it's just, different things that can help you with, I'm sure you've got questions like you did earlier when we were talking about,
Right.
I feel like when he asked me about my mom, that this is kind of like I'm breaking the news to him.
Right.
But there's all kinds of tips
Okay.
that I'm going to give
Great.
you for kind of handling that.
Great.
It also goes into some of the different things that we've been seeing
Right.
with the hallucinations.
Okay.
And, that's something that the sooner we can get this workup completed
Yeah.
and get that MRI scheduled and get a diagnosis, and there are some medications that could help with those
Okay.
hallucinations.
Great. I'll
Um,
share this. I have a sister that lives in California,
Oh, yeah.
so we'll
More
try to get her.
medications.
But this one would be helpful because it would take away some of those scary, scary hallucinations. There's also stuff in here about wandering.
Okay.
There's stuff in here about agitation, and just so much stuff.
Okay, great.
It talks.
Is this stuff from the Alzheimer's Association or where?
Actually, this is
Little different.
it's the Family Caregiver
Oh, nice.
Alliance.
Okay,
Yeah.
good.
So eating and nutrition.
Nice.
Those changes you're seeing in the evening.
Okay.
The strategies with bathing.
Okay.
And then, some wonderful, wonderful
Great.
resources that
That's
I'd like
great.
to give you.
Okay.
So basically, the next steps is I need him to stop taking that Benadryl,
Oh,
okay?
that's okay.
Yeah, that is one of those things that could be causing his memory changes.
Okay.
So there's a list of medications, and it's called the Beers list. And everyone's like, what? Tell me what that is. So it's put out by the American Geriatric Society. And so it's spelled BEERS.
Mm.
And you can actually go online and find this list.
Okay.
But it's a list of medications that are really contraindicated in somebody who's having memory problems. Now, I looked at his list of medications. I didn't find any other medications that were on
But
that
the
list.
Benadryl.
But
Okay.
that Benadryl,
Okay.
that's
We'll just
a
get it
real
out of there.
common. Yeah, just take it out of the house.
Is there anything else for sleep that, I don't know if besides that we could try or?
There are other medications.
See, Benadryl's easy. I
Yeah.
don't have to go to a doctor.
Yeah, this one you would actually have to go to a doctor. But here's what I'm going to tell you: is there's some sound strategies, and see, part of this is what's going on with the memory changes and the agitation and the
Right.
hallucinations, all that stuff coming at night. So I know that we can, once we get a diagnosis, we can figure out what to do with that.
Okay.
But in the meantime, some really good strategies is that he needs to shut that TV off or any computer or cell phone device 2 hours before bedtime.
Okay.
And that's a big lifestyle change for a lot of people.
Mm-hmm.
But what happens is your brain just gets wired to wake up, and by shutting off those electronics 2 hours before bed. So you like to read. So 2 hours before you go to bed, work on reading, listening to some soft music, really doing things like that. And then the other thing that he can get that is over the counter that's worth a try is
Okay.
melatonin.
Oh, I've heard of that.
Yeah, and so 3 to 5 milligrams is
Melatonin.
melatonin.
Mm-mm.
Oh, that's a great question. You're wondering what I'm talking about. So
I have a
melatonin,
clue.
yeah, so you know what? It's a natural hormone that your body produces. And believe it or not, as you get older, that melatonin in your body, the levels go down, and then you have you have a harder time sleeping as you get more experienced in this life. So now the other common culprit is, and I'm not sure, are you drinking coffee?
Yeah, of course.
Okay. Do you know what happens? And this is really happening to you, is that your body, as you get more experienced in life, your kidneys actually stop getting rid of that caffeine. And we already know you have some kidney disease. So that's a double whammy. So that may be keeping him up at night.
So even in the
too.
morning, it's
Yeah.
so it wouldn't even.
He can drink maybe 1 cup, but as we get older, that 1 cup is going to last all
Interesting.
day long.
Yeah, 70-year habit.
Yeah.
Yeah.
So some strategies.
Okay.
I'm not a mean person. Okay. Please don't think I am. But some of the strategies is to slowly cut back. 1 cup less a day.
Mm,
And then you can just switch to decaf.
okay.
Um,
Because you do that. You can usually have some in the afternoon, even. I think usually when I'm down.
Yeah,
Yeah.
yeah.
3 o'clock.
Okay. All right.
Yeah, yeah.
Well, we can switch to decaf.
Yeah, but do it kind of gradually.
Okay.
Because otherwise he's going to feel pretty ill.
Okay.
Yeah.
All right.
You may not be his best friend after that.
Okay.
So, okay. Now, what questions do you have for me? I've kind of done a lot of talking here.
Oh, that's a lot of information.
Yeah.
How am I going to remember all this?
You know what? I'm going to give you permission to not remember this. And I'm going to tell Troy that
I've been
he
taking notes.
he can go over his notes and, you know, we'll definitely get you in to see the nurse practitioner as soon as possible.
Will I get better?
So we you know, like I said, we're looking at all kinds of things. So if we find a lab test that's off, we're going to certainly go after, like, let's say you're low on vitamin B12 level. We'll get you some vitamin B12, and we'll see if that helps you. Now, the other thing we didn't talk about, but I'm going to let the nurse practitioner work on this, is it could be that he's got some sleep apnea.
Yeah. Well, I was gonna. I
Yeah.
was gonna ask about that.
Yeah.
So, do we test for that, or what?
I'm going to let her,
Okay.
weigh in that if she thinks
Is that why I wake up with dry mouth?
could be because of the snoring, huh?
Yeah.
Yeah. Yeah.
Yeah. That'd be if
But
we
you know
can.
what else it could be? It could be because of that Benadryl.
Oh, that's interesting.
Dries you out.
Yeah. So maybe we can figure out a way to. Maybe we can't, but maybe we can just have you come up and do a bunch of these things, and you can stay with us for a little bit. We'll see.
That's probably a good idea. Hey,
We'll figure it out.
you can visit some of those grandkids, right?
Yeah.
Yeah.
Okay. So what other questions do you have for me?
I'm really worried about, people being in the house.
Yeah. Yeah.
I
Yep.
mean, intellectually, I know they're not there.
Well, but it's still very real, isn't it?
Yeah.
Yeah. So I think that, I'm going to say let's get you off that Benadryl. Let's see if that makes a difference. Let's see if we can do some of these other things to try
Okay.
and decrease some of that agitation, especially
And,
around.
what about all the medications? I really struggle with the medications.
Yeah, we're going to try and get some assistance to help out with that.
Yeah.
Yeah. So Troy's got that assignment.
Mhm.
Okay.
He's going to work on that. And Troy, what questions do you have for me?
Well, this sort of blindsided us, and my sister and I are we're in a tough spot because this is his, blissful home that he's been in, and we're very worried about his ability to live
50
alone.
years.
So, and again, that's probably down the road, is just trying to figure out,
I don't even want to think about it.
yeah.
And I think that I completely understand your concerns. I think that if you start poking around in the Alzheimer's Association website, you'll find that there's a lot of resources there. Certainly having that conversation with some of the other resources that I've given you. And let's
Let's
find
see.
out what, I think that, figuring out what's going on
Yeah.
is going to be really critical.
Okay.
And then, and once we have that cause of your memory problems, then we can put together a real comprehensive treatment plan.
Okay. Sounds good.
Yeah. But I
Yeah.
think we're kind of in a little bit of a holding pattern.
Yeah.
Certainly you can start doing some of that poking around.
Okay. Yeah, but a lot to
And
do.
the VA may have some good resources too.
I think the doctor, when we went there, said they had some stuff that could help with the house, but I'll have to figure it. I'll call them.
Yeah.
I
Yeah.
don't know if they
like
do that
going
in a
to
rural
VA.
place.
Okay.
I like going to VA.
Yeah, that's great. That's great.
Yeah.
Well-
So anyway, this has been incredibly helpful, and we didn't even know where to start. So this has been
Yep.
really good.
Yep. Well, we need to get the ball rolling, and we will do that.
Okay.
But it has been such a pleasure to meet you today. Let me just shake your hand.
Thank you.
And
Your name is
Nancy.
Nancy.
So how will we know about, like, who's gonna coordinate all these appointments, and who we talk to?
I've gone ahead, I want you to get your blood drawn today. We've got the medical assistant here who can do that. The next step is I've got standing orders, so I'm gonna go ahead and place an order for it's called a MRI, and it's
Okay.
a non-contrast, biomarker specific, very fancy. But that's the right kind of MRI we need. I'll go ahead and place that order, and then, I'm gonna have the receptionist actually call up to the VA and see
Okay.
when we can get him scheduled.
What is an MRI?
You know what, it might be best if you called and got that, I mean, I can,
If you send the order, then we can
Yeah.
try to call them and just say, well,
'Cause
once
you
we
have-
know all those other things we wanna do, we can try to see if we can schedule it all at the same time. Or
yeah.
whatever. But the MRI sounds like that's
Now, we have to get that right
real
away.
urgent. Okay, we'll
Yeah.
just do, we're up and down all the time, we'll figure it out.
Okay, yeah, because I was just saying, if I try and make that,
Yeah,
they need
that's-
your schedule.
Yeah, my schedule with work is pretty tricky, so.
Yeah, yeah. So, but anyway, I think that those are the first
I think you had a question,
steps.
did you miss something, did we miss you on something? I can't remember.
Yeah. What is an MRI?
Oh, yeah, right.
Oh, yeah, you know what, it's gonna take a picture of your brain. And then, we'll be able to see, what's going on and, if there's any reason why you've got memory changes.
Okay.
Yeah,
Okay. Sounds good.
yeah. Okay,
All
Troy,
right,
it was
it's
so
been
nice to
very
meet
helpful.
you.
Thank you so much.
All
and we
right.
will just keep plugging away.
So I can drive home?
So we're gonna have Troy drive you home.
We'll go out and drive together. All right.
All right. Good questions. All right. Thanks so
Thanks.
much, you guys. It was
Appreciate it.
so good to see you.